All right, so let's start. So obviously it's week 1. So I've given you the 5 key points of Progranme Pilates method as your homework. So I will just review that first of all. So if you remember, the most important thing to learn, if you like, or to reiterate with low back problems is your posture, and how over the years our posture has, not you particularly, anybody, our posture has deteriorated because we're so much in this forward movement now. We've lost the use of the shoulder blades, and in fact the gap between the shoulder blades has got too big. So in fact we're not supporting ourselves. So we need to redress those issues. So if you're standing sideways, you should have 3 points of connection. I think I went over this. Let me just get my roller. I can demonstrate that with this. It's quite good. So if I'm standing sideways, there should be 3 points of connection here. Remember, this is your support network, the shoulder blades and your hips. So if I'm here, 3 points of connection behind the head, shoulders and hips. If I'm too rounded in the upper back, or I've lost the use of those muscles, this happens. So I'm not connected anywhere, and then my back is too flat. I'm losing the neutral spine position. So in my classes, we try and redress that. And then every exercise we do, actually, you pretty much need to have your spine in that position, pretty much. So that's posture. Again, chin retracted. Again, we need to get out of this movement here. I think someone's just written on the screen. So let's see. Hello. I've got no volume. Okay, you're all right now. Fantastic. Do I have to repeat all that? You can watch it later. Okay. All right. So yeah, if you missed that, I just went over the 3 points of connection. I've already been over that with you, Natalie. So posture is number 1, and there's no point obviously in strengthening if we've got the wrong posture. There's no point in strengthening our buttock muscles and the muscles around our spine. If we're like this, we need to strengthen in the correct position. So the second thing we need to look at with Pilates is our neutral spine position. So a lot of low back problems do come about, one, the lower back being hyperextended that way, and then obviously the gaps between the vertebra compress, and that can cause pain, cause sciatica, buttock pain, etc. And of course, as we get older, we do lose, naturally, we all do, we lose a bit of the cushioning in between the vertebrae. So that exacerbates that problem if we're overarched there. And the same thing if we're overstretched that way, you've got no support network here. So we need to find what we call our neutral spine position. So bend the knees a little bit, one hand here, one hand here. So just sort of tuck the hips under a tiny bit and then overextend the other way. Now somewhere in the middle, you should feel the abdominal muscles here, the lower abdominal muscles clicking in, or if you like, engaging. So that's your neutral spine position. Okay, it's easier to, if we're on the floor actually, to go over that, but that's what we need to do. Knees slightly bent as well. If you straighten your knees, straighten your legs, your hips naturally go back, and that again can exacerbate a low back issue, push the spine out. So if you're standing in a queue or something like that, it's always best to remember, have the knees just a little bit soft, and then your back can go naturally in your neutral spine position. Or if it's uncomfortable, just take the legs a little bit wider, bend the knees, tuck under a little bit so there's a little bit of pressure off there. Okay, so posture, neutral spine position. Next is the breathing. Are we okay? I'm just going to see if you've got any questions. You okay? Hopefully. Oh, okay, we're gone. Shit, what's happened? Hello? Hello? Oh, continue. Oh, what's happened? Ah, there we are. Oh, there we are. I pressed the button and it turned the camera around the other way. Oh, honestly. Okay, so I'm going to go over the breathing now in Pilates, which again is very important, but it takes a long time to sort of get the breathing going with the neutral spine and everything else. So I have to explain it, but please don't worry. if you don't get it, first of all. So 3 points of connection, neutral spine position. All right, so place your hands here on your rib cage. You're going to breathe in through the nose and breathe out through the mouth. Okay, as you breathe in, you're going to feel your rib cage just expanding a little bit sideways, and then you breathe out, close the rib cage, draw the abdominals in, connecting the core muscles, making sure when you breathe out you're not leaning forwards like that, keeping that neutral spine, shoulder blades back and down, breathing in, breathing out. Now, to engage the core a little bit more, what we can do, just to start you off, squeeze the pelvic floor muscles, and immediately you should feel some muscles working here. Squeeze the buttock muscles as well, and again, hopefully you're already feeling your core muscles. Then breathe in through the nose, breathe out through the mouth, and again engaging the core. So from here all the way up, we're feeling our support network, that core connection there. So again, don't worry if it's confusing. When I'm teaching, I go through it all the time. Breathe in, breathe out, legs, etc., etc. Pelvic floor, buttock muscles. It doesn't mean you have to keep the pelvic floor pulled in all the time. It just helps you activate your core muscles. Okay? So 3 points of connection: chin back, shoulder blades back and down, neutral spine position, pelvic floor, buttock muscles to help engage the core, breathing in through the nose, rib cage expanding, breathing out through the mouth, abdominals in. So that's engaging the core. That was our next, that was number 4 in my 5 key points. So engaging the core. Well, and that's all very well because we're not doing anything at the moment. But the key is to engage the core, keeping your core connection, keeping the 3 points of connection as we go into movement. There's no point in losing that if we're then leaning forwards and always straining our back. So the idea is to start moving, keeping the 3 points of connection. So 3 points of connection: chin back, shoulder blades back and down, neutral spine position, pelvic floor, buttock muscles, breathing in through the nose, breathing out through the mouth, and draw those abdominals in. Okay, can you feel those core muscles engaging there? So adding movement, what we'll do, just to start off with, we'll do a little bit of a warm-up, and again it's a little bit of a practice to keep that neutral spine position. So arms down by your side, again neutral spine, breathing in, breathing out. Try and get the core muscles working straight away, and we're just going to roll those shoulders forwards, up, back and down, and add the breathing in. So breathing in, breathing out. Squeeze the shoulder blades together, keeping your 3 points of connection, chin retracted. So every time you breathe out, we try and draw the abdominals in. So how the breathing works, we breathe in to prepare for an exercise, and we breathe out, engage the core when we go into the main part of the exercise. So here is breathe in, breathing out. This is just practice really for engaging the core muscles. Neutral spine position, breathing in, breathing out. So nice and slowly. So the object of today really is mobility. Any questions? Are we okay? We seem to be okay. Good. Okay. Do ask any questions. Ask away. All right. Breathing in and out. And then just one arm on its own. So we're just trying to get the shoulders moving. Breathing in and out. Okay. And there's a little bit, try and get the upper body moving. So keep the hips facing the front and just get that upper body moving. Breathing in, breathing out. Any pain at all in the low back, please just remember I showed you can just sit on the chair and do this. All the upper body warm up can be done sitting on the chair. Okay, one hand on the shoulder, and you're going to take it up. Now what I want you to do is watch your elbow and then take it round. Breathing in, so you're lifting the chest, opening up the shoulders, breathing in, breathing out. And the other side, breathing in, so abdominals in, breathing out, lift that chest. So we're opening up the shoulders there. All right, arms by your side. Breathing in, breathing out. Raise one arm up, take it slightly behind you, so you're lifting your chest, and then reach. So you're really feeling the stretch from here, from the back muscles, and back. Breathing in, breathing out. Now when we move the arms in Pilates, it's very important not to lift the shoulder. We raise the hand. there, and then stretch up from there. So when you're stretching up, you're feeling it from the shoulder blade rather than hunching the shoulders, stretching up and back. Breathing in, breathing out, stretch slightly behind you, and then reach, lifting the chest, so you're lengthening the spine as well. Good, breathing in, breathing out, up and reach. Breathing in, breathing out, up and reach. Good, and then we're going to go diagonally, so similar to what we did just now. Watch the hand, and you're going to take it across, up and back. So lift the chest, still keep that neutral spine position. So breathing in, breathing out, abdominals in as you reach up. So can you see, as you're actually doing a movement here, but you're drawing your muscles in, so you're supporting yourself as you go into, it could be a leaning move, yeah? So breathing in, breathing out, or picking up, actually car seat, safety belt, that's it, that one there. Good, and the other side, breathing in, breathing out, up and over. So follow the hand, so you're just lifting the chest, breathing in, breathing out. We're getting a little bit of stretch in the neck as well. Okay, how are we doing? That's it. Okay, just give me a like if you're okay. Oh, I can see that everything's all right. Okay. Okay. Breathing in, breathing out, up and over. Okay, both arms up, stretching, reaching up, abdominals in, and then I want you to reach up from there. Again, try not to hunch the shoulders, bring the arms back, and you're stretching up from there. Good, all the way back, opening up, hold it there. Okay, now think about the shoulder blades. I want you to squeeze them together, take the arms back, watch your neutral spine position, abdominals in, and just a little pulsing action. So working the muscles around the spine and the shoulder blades. Good, and back. Bring the hands to the front. I want you to cross the hands over. Bend the knees a little bit, keep the hips facing the front, and just turn the upper body, breathing in to the side as far as it's comfortable. Breathing in, turn the head with you. So again, we're just working on mobilization. Breathing in, breathing out. There. Good, and then the other one. Breathing in, breathing out. Nice and slowly. Good, and back. All right, hands down by your side. And we're just going to work on mobilizing the head and the neck. Neutral spine position, breathe in, breathe out. Try and keep the core muscles engaged. So the secret is, with Pilates, when you get a little bit better at it, you're actually keeping those core muscles engaged pretty much the whole time. And then relax the chin forwards, draw it back. Breathing in, breathing out. Keep the shoulders down. And then lifting the chin up and down. Slowly, breathing in, breathing out. Okay, and then take the head to the side, keep the shoulders open, and then roll that head forwards. Nice and slowly. Look over the other side, try not to let the shoulders move. Breathing in, breathing out. Head to the side. Good. Back to the centre. Relax the ear to the shoulder and add your arm in. Good, and the other side, ear to shoulder, add your arm in. So be mindful of your posture, breathing in, breathing out, stretching the arm down. Good, hands behind the head, tuck the chin in, breathing out, head forwards. And slowly coming up. Good, all right so far. Any questions? I'm just going to go down. We're nearly going down onto the floor. Just let me check if you've got any questions. You okay? Okay, good. All right. Don't let me know if I'm going too fast. So legs a little bit wider. So we're going to go into our inner thigh stretch. Now, very important here is our squatting technique. So anytime we go into this sort of movement, we're not actually doing squats today, but we will do probably next week. But every time we go into this lunging action, you're almost simulating what you would do if you were picking something up, off the floor or reaching into a cupboard or something. So we need to keep the shoulder blades back and down, our 3 points of connection as we go into that movement. Can you see there, rather than there, if I'm like that, the strain goes into the low back. And we also need to be mindful here of the knee alignment. So again, if you repeatedly do movements where your knees go further forwards than the end of the feet, it puts pressure on the knee joint. So when we go into the stretch, we need to sink the hips back, have the legs wide enough, breathing in, breathing out, so we're going into that stretch. Make sure this doesn't happen. Can you see the difference? Breathing in, breathing out. Now shoulder blades back and down. If you find it's very difficult to keep your upper body posture like this, because you're concentrating on everything else, just keep the hands here. And then breathing in, breathing out, abdominals, shoulder blades, sink the hips back. So you should feel your core muscles engaging, breathing in, breathing out, and you're supporting your back into that movement. Take the legs a little bit wider. If you can, turn the feet out, so we're getting that inner thigh stretch. Good, and then the other side. Great. Okay, we're going to do a front of the thigh stretch. So hold on if you need to. Hold your foot. Okay, so we're going to try and add the breathing in here and the core engagement. Neutral spine position. Breathing in, breathing out. Draw those abdominals in. Push the hip forward. Bring the heel in towards the hip. And feel that stretch in the front of the thigh. That's it. Good. And other side. Breathing in, breathing out. Bring that knee back. The idea is eventually to get the knees level. Heel in towards the hip. Breathing in, breathing out. There. Okay. All right so far? That's it. Okay. Okay, good, good, good. Right, so what we're going to do now, we're going to get ready to go down onto the floor, onto the mat, so get your mat ready. You can take your shoes off if you want to, up to you. I'm just going to introduce a little roll down. We're just going to do like a half roll down today. So just let me show you. So we're here, breathing in, breathing out, core muscles if you can. Now you need to hinge the hips back, don't arch. Remember that position I just showed you with hinging the hips back. Don't let the knees go further forwards than the end of the foot. And we're going to do like a half roll down and up again. Breathing in, breathing out. So abdominals in. This time you're opening the shoulder blades, rolling forwards, and then you're slowly coming up. Okay, are you okay with that? Yes, are we okay with that? Hopefully. Okay, if it's uncomfortable on your back, obviously don't do it, or just do a very, very tiny movement. Breathing in, breathing out. Hinge the hips back. So from this position, whether you're here, or if you can roll down a little bit further and it's not uncomfortable, you can do it from there. We're just going to stretch out the back of the legs a little bit more. So here, we're here, either here or further down. Bend the knees a little bit. Breathing in, breathing out. Abdominals in. Hinge the hips back. And I want you to feel that stretch in the back of the legs, buttock muscles, back as well. Bend and straighten. So either keep it here, breathing in, breathing out. If it's really uncomfortable in that position, we can always do it from a standing position here. There, relax, breathing in, breathing out. So if you're watching and you're having a bad back week, okay, your alternative would be like this, breathing in, breathing out. So you're still stretching, but there's no strain there. Or even if it's more comfortable, we can just do it like this on the wall. So you're standing, breathing in, breathing out. There. Okay. So we're going to get down onto the mat. So if you're able to, from here, hands onto the mat, coming forwards, or just any way to get down any way you can, and come forwards. And then we're going to go, I like to use my grips here. We're going to go into what we call our downward dog stretch. So here is your level 1. If you're able to, we're coming up into this position. Okay, so whichever level you're comfortable with, hold it there, shoulder blades back and down, feel that stretch in the spine, hips up in the air, and heels down towards the mat. If it's uncomfortable, please come down into this position, and then you can do the downward dog stretch from there, shoulder blades back and down. Okay, so coming up, if you're able to, this is what we call our downward dog stretch. It really stretches out the spine. Keep the shoulder blades back and down, heels into the mat, and then come up onto the balls of the feet. Breathing in, breathing out. Hinge the hips back, up and down, and then alternating. And really feel that stretch in the back of the legs, in the spine. That's it. Okay, so from here, you're going to try and bring your weight forwards. It's a bit like a mini plank. Don't take the weight too far forwards just yet if you can't. And you go back into the downward dog stretch. Again, if it's uncomfortable, please come down into this position. So you're stretching back like that if you're not able to hold your plank position. So just coming forwards a little bit, so we're strengthening the upper body. Breathing in, remember, draw the tummy muscles in, so you're supporting your back, your tummy, work at your own level, there and back. All right, and then just relax. Stretch back, hips back down, arms out in front. It's a nice stretch for your lower back. Again, if you can't quite get that position, don't worry at the moment. You can put a cushion, a ball here, or just come down into any variation. This is a great stretch to do. If you're having bad back issues, it lengthens out the spine. Breathing in, breathing out. Relax the hips back down as far as it's comfortable. Relax the arms out in front, and you should feel your low back just lengthening, stretching out. Don't force anything. Nice stretch. All right, come back up on all fours. Okay, so our first important exercise for today is what we call our cat stretch. Really good for mobility of the upper back. Again, because if your low back is quite stiff and immobile, because of this sort of positioning, we need to extend the spine and get that moving. So the cat stretch helps with that. Now with the cat stretch, you probably see lots of other like yogas or whatever, like out the Pilates instructor, they lift the head, they arch the low back. So my way of doing it is very mindful that we suffer with low back problems. So we do just quite a small movement here. So hands under the shoulders, knees under the hips, breathing in, breathing out. So draw the abdominals in. So think of the tummy button going through to the spine. Close the rib cage as well. And then open the shoulder blades. Tuck the chin under. So you should feel a really nice stretch here. Curl the hips under a little bit if you want to. And then relax, breathing in. Now breathe out again. Draw the abdominals in. Lift the chest. Don't lift the chin too high. Head just lifts because you're lifting your chest. We don't want to compress the back of the neck. And don't overarch the low back. Just get the abdominals working there. Can you see that? Lengthen through the spine. Breathing in, breathing out. Tummy in. Open the shoulder blades. Breathing in, breathing out. Stretching, rounding. Breathing in, breathing out. So don't overarch the back. Focus on drawing the abdominals in, lifting the chest, opening up the spine. Breathing in, breathing out. There. There. Good. And then stretch back again into your cat stretch. Reaching the arms out in front of you, relaxing your back, and then bring the hands down by the side of you if it's comfortable. Breathing in through the nose, breathing out through the mouth, and this just lengthens your spine there. Great. Good. Okay, I want you to roll over the other way, and we're just going to do a little bit of our pelvic tilt and to go over our neutral spine position lying down on the mat. So we're this way round. Now when you're doing anything in Pilates, when you're lying on the mat, again, we need to have our neutral spine position, but also we need to have the neck lengthened. So if you find you're like this, Okay, we need to put something like a cushion, or I've got one of these balls, at the back of the head. So if you make a fist, place it underneath your chin. Okay, there's no gaps there, so the back of the neck is lengthened. If you're very extended like that, it usually means the upper back is too rounded. You'll find it difficult to keep the neutral spine position. So just add a sort of cushion or one of these balls there if you need to. So if you make a fist, place it underneath the chin, there should be no gaps there, so you're lengthening the back of the neck. Okay, so if you remember, we did that neutral spine position, standing, so we need to find it here, lying down. So if you take your fingers, place them under the small of your back, your fingers should get stuck if you're in your neutral spine position. If you find they go all the way under, like that, you're too arched. Okay, if they don't go under at all, okay, you're too flat. So we need to find again, just go forwards and back a little bit so you find that place where you're drawing those abdominals in. That's your neutral spine position. Okay, okay, so let's try the breathing in our neutral spine position. So pelvic floor, buttock muscles to engage the core, breathing in through the nose, rib cage expanding, breathing out through the mouth, rib cage closing, and then think of your tummy button going through to the spine. So you're pressing, you're not curling the hips under just yet, that's an exercise we're going to do in a minute. You're just pressing the back towards the mat, so you're keeping that neutral spine position. I don't know whether you can feel that. Breathing in through the nose, rib cage expanding, breathing out through the mouth, rib cage closing, keeping the neutral spine position. Breathing in through the nose, out through the mouth. So that's pretty easy. Next week, we'll be adding in some movement. I'll be giving you some homework as well. Some movement, and the challenge is when you're moving an arm and a leg, that you're not letting your back arch. So you're drawing the abdominals in, keeping that neutral spine position while you're moving. Okay, so I'll give you a little bit of homework clip for that. Okay, so from here, we're just going to do a little bit of a pelvic tilt. So you might find your low back is very stiff, so we need to loosen that up a little bit. So all we do, it's a pelvic tilt. So squeeze the buttock muscles, pelvic floor buttock muscles, breathing in through the nose, breathing out through the mouth. Draw the abdominals in, squeeze the buttock muscles, and you try and curl the hips up off the floor. Not fully yet into a shoulder bridge, but then roll it back down. So it's just a tiny movement, up and down. It might not look like I'm moving it very much here. It's difficult on the video. Just squeeze the buttock muscles, so it's literally just your lower back. You're trying to get the movement there. Breathing in, breathing out. Rib cage, abdominals, curl the hips up, and then roll back down. Nice and slowly. Okay, is that okay? Does that feel comfortable? Any questions, anybody? Let me know. We okay? Okay, good. All right, so this action and this pelvic tilt, if it's very uncomfortable, if it's hurting, please just continue literally just with that movement. Breathing in, breathing out, curling up and down. Just getting that lower back working. If it's not a problem, then we can go in a little bit more into our shoulder bridge. So just watch first, breathing in, breathing out. Buttock muscles, abdominals, curl the buttock muscles, curl the hips up as you squeeze the buttock muscles. So this time, you're bringing your back a little, or your spine a little bit more off the floor, and then roll it back down. Okay, so we can work on this. So over the week, if you're finding this comfortable, we can work on just taking it up a little bit further. So we're getting that spine moving, stretching out the vertebra, lengthening the gap between the vertebra, which is what happens when we lose, collagen, cushioning in between the spine. Breathing in, breathing out. So try and get a little bit more movement there, and then roll that spine back down. Breathing in, breathing out. Buttock muscles, curling up, not too high, and then roll it back down. Okay, good. So I'd like you to practice that in the week as well, and then trying to get up when you feel comfortable a little bit further until you feel a stretch here, and then a little bit further down. So we'll go over that a little bit more next week. Okay, so we're just going to finish off with some leg and hip stretches, very basic one this week. So I want you to stretch one leg out, bring the other one in if you can. If it's too much, bend the knee. Draw that leg in. Now press your lower back into the mat. And this is a very, very good low back stretch. Okay, breathing in, breathing out, hands underneath the thigh. Draw that leg in and press your lower back into the mat. So you should feel a really nice stretch there. Again, don't lift the hips here, keeping your neutral spine position. The other leg can go straight out if it's comfortable for you. Good, and back. Breathing in, breathing out, bring the other leg in. Hand underneath the thigh, draw that leg in and press your lower back into the mat. Again, getting that stretch in the low back. Other leg can go out a little bit further if you can keep your neutral spine position. You want to hold it for at least 10 seconds. Good, and the other one. Stretching. Breathing in, breathing out. So if your low back feels very tight, this is a great stretch to do. This is like level 1 really. It's again, it's an introduction. We're going to build up on this. Good. Okay, so we're just going to finish off with a couple of leg stretches on the floor. Now, if you've got a stretchy band, you can grab that and it'll help you having to sort of reach up and down. So you're going to wrap the band around your foot. Add as much resistance as you need to. Make sure you're not taking the hips off the mat. So your right leg can be bent or straight, just as I'm leaving it bent. And you're going to stretch the toes back and then point them. Breathing in, breathing out. So work on stretching out the back of the leg without lifting the hips off. Add more resistance with the band if you want to. You can bring the leg back as far as it's comfortable. If you're only at this position, it doesn't matter. Point the toe, flex the foot. Breathing in, breathing out, breathing in, and then we're going to hold it in that position. So you should feel a really nice stretch in the back of the leg. Okay, take the band away. Okay, so we're just going to do, well, it's like a bit of a spine stretch, but it's an outer thigh stretch. So take this leg out a little bit further if you can. Bend this knee, take it across the body. So this is my left leg here. I've got my right hand over the top. Left hand out along the floor, and it's just a gentle stretch for the outer thigh, for the buttock muscle, and a little bit of stretch for the spine. And don't force it, and just take it over as far as it's comfortable for you. Taking the head out towards the arm, breathing in, breathing out, and you can stretch it over a little bit more as you feel comfortable. Again, this is something we can build on as the weeks go on. Bring the leg back. Now we're going to do our hip stretch. So left foot on the bent right knee. Neutral spine position. Level pelvis. Turn the knee out to the side, just so you get a stretch in the hip joints. Good. And then we're going to do the same stretches on the other leg. So grab the band. If you haven't got a band, it doesn't matter. You can just do, just hold the back of the leg. Okay. Other leg bent or straight, up to you. Neutral spine position. Point the toe, breathing in, breathing out. Flex the foot back so you really feel that stretch in the back of the leg. You can work on straightening the leg a little bit more. You can draw it back a little bit further as the weeks go on. So we're improving, breathing in, breathing out our flexibility, making sure your back doesn't come off the floor, keeping your neutral spine position. Breathing in as you point, breathing out as you flex. Great. All right, I'm going to take the band away. Keep that knee bent. So this is your right leg. Take the left hand on the outside of the thigh. Straighten this leg a little bit more if you can. Right arm goes out along the floor. Breathing in, breathing out very gently. Take the leg across as far as it's comfortable. So you get a stretch here in the outer thigh, the buttock muscle, and it stretches your hip, your low back, pelvis as well. Don't force it. Stretch it over as far as it's comfortable. Breathing in, breathing out. Good. All right, and then right foot on the bent left knee. Finish off with your hip stretch. Turn the leg out to the side, breathing in, breathing out. Good. And back. Fantastic. Okay, so we're going to roll back over. nice and slowly. Back on an all fours position. So we're going to go into our cat stretch again. Breathing in, breathing out, rounding and retracting. Breathing in, breathing out. And then we're going to come back up. If you're able to, coming back into our downward dog stretch, like this. Stretching, shoulder blades back and down, hips up in the air. Obviously, if it's not comfortable, just go back into this position. And then whichever one you're doing, keep the knees bent. We're going to walk the hands back up towards the feet. Hands on the legs. And we're going to roll up one vertebra at a time. Again, opening up that spine. Great. Okay. Arms slightly behind you, neutral spine position. Breathing in, breathing out. Shoulders forwards, up, back and down. Stretching up, so arms slightly behind you. As you reach up, stretch. I want you to reach up one arm a little bit more, making sure the stretch is coming from the shoulder blade and you're not arching your lower back. And then hands behind the head, breathing in, breathing out, head forwards, chin to the chest. And slowly come back up. Okay, great. So that's it for today. So hopefully this, what we've done today, I'm going to put it in the back care program where you found the pre homework. So do this 2 or 3 times this week, and then I'm going to add in a couple more exercises to do before the next session. Any questions, do ask, just message me, and then we can go over them.